Hey, welcome back to the show. My name is Roger Lodge, and ladies and gentlemen, it is time once again to get our Sports Lodge Health Tip of the Week presented by City of Hope. And guys, it's about to get real because today I want all of you to know something very important. You may not want to hear it, but the facts are the facts. The numbers don't lie. And right now the numbers say that more than 27,000 men die each year from this. It's the second leading cause of death by cancer in men. What type of cancer am I referring to? It's prostate cancer. Joining me to share some information, advice, and news on prostate and other cancers is a medical oncologist at City of Hope, Orange County, whose focus is primarily on kidney, bladder, and prostate cancer. And he's also penned over 300 articles for some of the top medical journals around the world. He is Dr. Sumanta Pal. Dr. Pal, thank you so much for the time. How are you, sir?
I'm doing great, Roger. Delighted to be here.
Thanks for the time. Doctor, tell me, what's taking up more of your time these days? Patient care or scientific research?
You know, I'm pretty unique in the sense that I've got a 50-50 split between both. I spend about half my time seeing patients, half my time in the lab, working with folks trying to discover new therapies.
And how do you combine the two?
You know, it's a pretty even split. 2 to 3 days a week, I'll see patients in the clinic. The remainder of the time, I'm really trying to strike this fine balance between pulling the right treatments from the laboratory into the clinic and also kind of working backwards and looking at patient data and trying to figure out where gaps are in terms of treatment.
Let's talk about some of the things that my listeners can do to lessen their chances of a prostate cancer diagnosis.
Yeah, absolutely. Great question. You know, prostate cancer, like breast cancer, like colon cancer, it's one of those unique cancer types where we actually have effective screening. So you may have heard of a blood test called a PSA, stands for prostate-specific antigen. That's a test that you can actually run through the blood that gives you some indication as to whether or not prostate cancer might or might not be present.
At what age should men start getting checked for prostate cancer?
So that's very debatable. And, you know, it varies a lot based on your family history, based on race. In broad terms, you can think of an age of 50 to start screening at. For some folks, much younger than that. But I would say that the most important thing is to start having a dialogue with your physician, whether it's your internist, your family practitioner, or your urologist, about getting that test done.
And is the test, because a lot of guys, doctor, are a little intimidated because they hear the stories about the test. Where are we on a test for prostate cancer these days? Is it less invasive, shall we say, these days?
Yeah, I think it's personally great that you can just get this information from blood alone. Now, if the blood testing points you in the direction of prostate cancer, that's where things get a little bit tricky. I would definitely suggest going to a place like City of Hope. We have a site down in Newport Beach, for instance, where we can sort of talk through whether or not further screening would be necessary with a biopsy. I think that biopsy step is really what scares people.
And after someone gets checked, when do they want to get checked again? How often?
We usually think of people getting tests done on an annual basis. It varies based on so many different factors. Roger, you'd probably need a couple hours to sort through all the details of it. But in broad terms, an annual screening would be pretty reasonable.
When is your line of work the most rewarding for you personally?
So, I'll tell you what, I have been an oncologist at City of Hope now for 14 years. And there are patients that I told 14 years ago, look, the average survival in your cancer type is about a year or so. And here I am 14 years later still treating them. To me, that is the most rewarding moment. And I'm hoping that I'll be able to say the same thing 30 and 40 years from now.
Hey, doctor, can you specifically tell me about the type of progress that you yourself have witnessed with some of the clinical trials that you've been involved in?
Yeah, and it's a major message. Part of the reason why you got to get to a place like City of Hope if you have cancer is the access that you'll have to clinical trials. Again, when I quoted to patients that a decade ago, 14 years ago, average survival was about a year or so, I truly feel like we were able to extend survival through early access to clinical trials. A big part of my research portfolio has been immune treatments, which are treatments that, unlike chemotherapy, which just attacks every living and dividing cell, really specifically stimulate your own immune system to go and attack the cancer. That's been a big area of my focus, and I think that's probably been one of the most transformative elements of cancer treatment more recently.
God, Dr. Pal, it's amazing what you do on a daily basis. And how confident are you that the next generation of treatments for different types of cancers will come directly from your City of Hope campus?
When I think back to City of Hope's history, probably the top 4 to 5 agents used in cancer treatment today are all derived from City of Hope technologies developed years ago. I think there's a very high likelihood that the cure for cancer down the line may come from our campus. I'm really hoping and praying that we find that cure, and I think there's a good shot that City of Hope is going to do it.
And what message do you want to send to the good folks that listen to my radio show here on AM 830 who might be a little hesitant to come in for treatment because of COVID-19?
Yeah, absolutely. Well, I don't want to at all undermine the risk of COVID-19. Having said that, with cancer treatment and cancer therapy, you got to get things going right away. Probably the best thing you can do for yourself is jump onto treatment or screening, et cetera, early. We have very, very rigorous safety practices at City of Hope. I, as a physician, seeing thousands of patients during COVID-19, feel very safe walking into the hospital. And I would say at City of Hope we'll do a good job to take care of you so that you have that same level of security.
And Dr. Pal, what's your message for everyone out there when it comes to wearing your mask?
Oh, man, please do it. There's just no excuse not to. I tell you that the mask is just essential. If we're going to do one thing, and it's easy to combat COVID-19, it's putting that mask on.
Can you tell my audience about your medical background and how old you were when you said to yourself, you know what, this is how I want to make my living? And then where did you get your education when it comes to all this?
Yeah, that's a great question. So, I actually had this very unique opportunity to start college early. I started over at Cal State Los Angeles in this program when I was 13, and I finished up there at 17, and I started at UCLA Medical School at that age. I have to tell you that jump start really gave me an opportunity to invest a little bit more time in doing research, building up my academic career, and I just thought that City of Hope would be the best landing spot for me, and I've been there ever since.
Well, thanks a lot, Doctor. Now I feel even worse that I'm 18 units short of graduating from Whittier College. Thanks a lot for that.
Hey, let's get it done, man.
He is Dr. Monty Pal from City of Hope, offering up his expertise when it comes to prostate cancer and treatment and so much more. And it's our Sports Lodge Health Tip of the Week, brought to you by City of Hope. And if you or a loved one needs cancer care, call them right now, 949-763-2204. Again, 949-763-2204, or log on to cityofhope.org/OC. Doctor, where do we go from here? What do you want to accomplish next?
I want to make sure that we spread the message about getting second opinions for cancer treatment. I think it's so important when you hear the C word to just go to a center of excellence for your care. Proud to say the City of Hope probably has the best and the brightest in every field within cancer here in Southern California and beyond. So get that second opinion. I am quite confident that as a cancer patient, you'll be grateful for it, and it may totally shift the direction of your care.
Dr. Pal, you are amazing. Thank you so much for the time. Keep up the unbelievable work, and we appreciate your time here for our Sports Lodge Health Tip of the Week, brought to you by City Hope of Orange County. Thank you, sir.
Thank you, Roger.
Dr. Monty Pal, City of Hope, in the Sports Lodge for our Health Tip of the Week. We're back after this.